I think it's a comment across the board on all the things you said. So, Kelly, thank you for telling us your personal story, but I think it actually highlights the issues for women, whether, as you described, they are not poor, they are poor, they are of color, they are dealing with cancer or even just basic preventive care for themselves and their children, that we have a system in the state that so far isn't working. Now, we have an opportunity, and I appreciate Jasmine and Aaron's testifying to what exists because of the National Health Care Act, or what will exist by 2014. It goes a long way to addressing many of the issues we've highlighted. But it also, for me as a legislator who I think even a week or two ago was voting against a bill to give a local option to shift to high deductible savings plan type of health insurance, which that was sort of the model of the Bush administration, to be partisan for a moment, that didn't work, that basically was insurance, which is really great if you're not sick and are rich, but actually is lousy insurance when you actually are sick or aren't rich and can't pay for things. So people like to criticize the plan that was passed in Washington that we're trying to move into and hope it's still there by 2014. But at the same time, here in New York State, on the Senate, we have actually colleagues who are trying to move the models we already know are failed models and have led to all the types of examples that you gave here today. And again, also appreciate, Senator Stewart Cousins bringing us all together around women's health, because it really does highlight we are treated differently.
Yes.
We are treated differently by insurance companies. We are treated differently by employers. I mean, Kelly, you and I have worked on equal pay for women. Well, if we had pay equity, probably more women would find themselves in jobs that actually paid a living wage and had health insurance, as opposed to a disproportionate number of women living at much lower income rates without access to health benefits at all. So I just wanted to thank you all, because I thought you each told your own piece of the story, but it's one consistent story.
Thank you. Thank you. Thank you, Senator Krueger. Senator Thompson.
Again, just briefly, because I know time is of the essence, but again, a lot of times people think that everything we do here comes out of our heads, and it's absolutely so far from the truth. But it comes out of these opportunities that you provide to help us to understand the nuances of what the picture really looks like. We like to believe that the state of New York is at the forefront of most issues, but when it comes to the issues of women's health, we're just as much in the dark as many other states. Maybe not as far as some, but they're pre-dark. We have the need for all of the kind of support and help that you can continue to give as advocates to make sure that the word not only goes out to those who are here today, those who've been in and out during the course of the day, but also to those who perhaps you think are not listening or may not think that this is a major issue. But anytime the issues are issues of women, then they're also family issues as well. And so people who might not be as sympathetic to women's issues certainly should be sympathetic to children's issues. There must be some caveat in there that will address and catch their attention. So we need you to help us to be creative about how do we make sure that as we put this together, that people who are not at present advocates with us become more of an advocate. Because this is really about how do we ensure good health practices for women. And if it means just being able to identify the economics of it, sometimes men understand that issue better than any other. So when we can talk about how prevention makes a tremendous difference in terms of what care really costs, then that can make a difference. I know that culturally, many times you'll see that women will put their health issues at the bottom of the list. When they've got families and other considerations, theirs must be at the top. And to use the phrase that they use on the airlines, help yourself first, before you can help somebody else. And so I think that that's kind of the posture that we're trying to take, and we just appreciate you helping us to get there.
Thank you, Senator. Senator Peralta.
Yes, thank you, Senator
Give
Stevens.
him this, so he
Sorry.
can be heard.
Thank you. Thank you. Thank you for having this forum, and I want to thank all the individuals that testified today. It's very important, as we all know, to hear from women advocate groups on women issues, because sometimes, especially on the other side of the aisle, they tend to forget. And we as Democrats want to remind everyone across the aisle that these are very important issues. So I thank you for today, for your testimony, and I also thank you for actually coming up to Albany and making this push. And this shouldn't be the last time that you do it. And I know that many of you come up constantly. I just bumped into another advocate coming here on my way here, and I talk to her constantly about reproductive issues that we've been facing and we've been trying to push on this side of the aisle. But I have a question in terms of maternity leave. I've been working closely with Assemblywoman Simotis, and we're looking to extend the amount of time a woman can take on maternity leave. And I wanted to get your thoughts on that, and what is your take on the extension of what currently exists now by law and what we're trying to extend it to? We want to extend it to a few more months. Yes, I want to be clear. We are looking to extend it a few more months unpaid.
Unpaid.
Yes.
Thanks for clarifying.
Yeah, I was very excited about it until you said unpaid. I have to be quite honest. I'm not sure how we improve the conditions for a mother to be able to care for her child, although she may be off work, to be able to do so if she doesn't have the resources to be able to do that. So I'm just curious about, if there are going to be social safety nets that then support these women. Will that be extended? What will that look like? And I would really like to see, as that develops, who your partners are, who you're speaking with, where you're getting your information from that informs that policy. Because for me, a woman has to be able to care for her child. Right. And she needs the access to the resources to do so.
So the answer is an extension with
pay. Absolutely.
That would be a resounding yes.
A resounding yes,
Okay.
with health coverage, with pay, with, protection for her job once she is able to re-enter the workforce, with her being able to pump at work. Those types of things would have to be included.
Okay.
I'm just going to do a promotion. We recently did another roundtable in this room around women and the workforce issues. Kelly was here for that. You unfortunately couldn't make it, which is okay. But we actually talked quite a bit about both Paid Family Leave Act and the ability to redesign our workers' comp benefits in New York State to actually help ensure that women can get paid for paid family leave without being an excessive new cost to the employers in the state, because we need to balance the reality of businesses in trouble wanting to keep people employed and respecting the need for paid family leave for both having a newborn or other emergency needs in the family. And we also, in that hearing, discussed the importance of pregnancy accommodations in the workforce, which is also another bill I carry that I'd love to see passed in this chamber.
Okay.